My experience is that some of them come right out and talk to you, but most of them, some of them ask you, um, excuse, excuse me, especially if they see me in a chair or whatever, or on crutches, they'll look at you and say, "Oh, where your big white book at? Who's here with you?"
Some of it is when I have my staff with me, and people will go to my staff and ask my staff a bunch of questions, and I'm like, "Why are you doing this? You know, I'm right here."
The doctors didn't really understand how to work with me, and they didn't really know how to do much or have any rehab with me.
If they have a must be up. They be like, oh, we don't have a list. Well, get, well, I say, go get a list. I'm not nobody trust me. They want to know the table. And my father, he couldn't lift me. I was going to lift. I was, even for, I was going to get mobility because my father, my husband had to get some people to put me back in my chair. I feel embarrassed.
I feel bad because we shouldn't be labeled. We should be treated just like they would treat anyone else.
What happened out of emergency room that I went to before, and what happened was this man came in. Either he couldn't read or he was too nervous and too injured to even try. And he asked the lady for help. And she yelled out, "You can't read?"
Hi. You here to see the doctor?
Yes.
Alright, I'm gonna have you fill out this paperwork for me, please. Hello. Hello. Are you here to see the doctor?
Yeah.
Can you please fill this out? Alright, what's the problem? Kind of taking a while.
Right now, I just can't see. Some words I can't know what's happening. Right, with people, I need some help with this.
You can't read?
Robinson,
Yes.
can you tell me what's wrong, maybe?
I don't know. I might be coming down with a common cold or the flu.
The flu, you said?
Yeah, well, I've been having headaches and I've been like sneezing and everything, and nobody has helped me that much. You think you can help me?
Yeah, I think I can help you. I think it's pretty simple, though. I think you just need a flu shot.
But it looks like you're not really doing much.
I mean, you seem to have said you cough, you got some cough, you got a fever, you got some chills. I think this is pretty simple. I don't think I need to hear too much more. Miss Green? Are you So you're here for your yearly physical today?
I'm not going.
But you are here for your physical, right?
Yes.
Okay. Well, that sounds good then. So we're just running through the basic stuff. Is that all right? Do you have any questions for me?
On my medicine,
Sorry, could you repeat that?
have the refill for my medicine.
Sorry, can't do that right now. You're just here for your physical, so you'll have to take care of that another time.
When do I get my medicine from you?
I don't really know. Sorry. You'll have to talk to a nurse about it, all right? Sorry, we're through here though. Thank you. Have a good day.
You can.
Remember to address the patient. Let the patient choose if he or she wants staff assistance. Be sure to clarify your patient's understanding. Fully explain any procedure or test that you will be conducting. Use language your patient can understand. Ask the patient what they want and give the patient autonomy on their decisions. Check and make sure that the patient's health passport is up to date on prescriptions, medications, and past medical history. Be sure to discuss this with your patient. Take the time to fully listen to your patient. There is a difference between listening to your patient and hearing what they say.
Of course, yes, they should ask me first if I need help with explaining something. Then I should be the one to ask the person that's with me to come in. But if I didn't ask, then you shouldn't.
Don't make assumptions that a person, when they're telling you about their medical history, that they don't know what they're talking about.
That's main important. Your eye contact. That's talking to you. Your eye contact.
Well, say, touch would show me how to walk. Slow it down.
Don't think that a person with a disability do not deserve all the information that you would give somebody else that don't have a disability.
To treat everyone with physical disability just like you would the people that don't supposed to have it.
I say this. Stop talking doctor talk and talk English.
I understand what the doctor is saying, then she should try to at least break it down in a better way.
We was asking people questions about what do they want out of life. And it was this one old man, he started crying. And the question was asked to him why he was crying. He said, this is the first time somebody ever asked me what I wanted. So, you don't know. So by you asking people and you telling people what they going to receive from you, you might be the first one that ever asked them their whole life about what they wanted and how their treatment should be. So make sure you do that.
Sometimes act like I can't talk. My mom's like, she can talk. You just have to listen to her.
If you use a wheelchair or will need help getting onto an exam table, discuss this with your doctor when setting up your appointment. Review any changes to your health passport with your doctor. Ask questions and ask for clarification if there are items that you don't understand about any procedures being done or changes to your medication. Your staff is there to help you. They do not have to be in the room with you. You are the best source of information about your health. You are an adult, and if you are not being treated like one, speak up for yourself. Be sure to discuss any follow-up appointments with your doctor.
The way that I advocate for myself as a patient is like making sure I speak up, and making sure that people know that I'm a grown adult, not a child. Don't talk down to me because you see me in a wheelchair, or talk down to me because you might notice that I might have a learning disability or what have you.
To be firm on you what you want and what you don't want. Don't let nobody pressure you into doing something that you don't feel comfortable doing.
If I'm comfortable, I can do stuff.
When you go to the doctor, ask questions. You know, what they supposed to be doing to you, not, you know, what that is for, what they doing to your body, because that's your body.
The staff is there to help you, not to help them unless you ask your staff to help you with them. But but like just going up to your staff, no, that's wrong and it's highly disrespectful.
I speak out for myself and let people know that I can speak for myself and I can educate my own self.
I say, first don't do that. Second of all, I'm not more capable.
Think about what, if any, barriers or negative experiences you have faced when trying to receive health care. What impact did these experiences have on you? What could have been done to prevent these situations? Identify the major barriers that people with intellectual and developmental disabilities face when trying to receive health care services. What non-clinical barriers to health care do you think people with intellectual and developmental disabilities face? Do you know of any programs that provide educational resources aimed towards navigating the healthcare system? If so, how could these be implemented within this community of patients?